Okay, so I'm Dr. John Puxty. I'm a geriatrician by training. I work as a geriatrician at the Providence Care Centre, but I'm also Chief of Staff of Providence Care Centre. Well, I'm actually the clinical lead for the Restorative Care project within the CSR initiative. Well, we know seniors, people over the age of 65, account for something like 2/3 of the hospital bed day use in southeastern Ontario and other parts of Ontario. Not all those outcomes are exactly what we'd like them to be. So a number of those individuals, in fact something like about 25 to 30%, actually end up in hospital occupying what we call ALC, or in other words requiring alternative level of care. A recent situation I became aware of, an 89-year-old woman is admitted to hospital with problems of failure to cope, weakness, fatigue, increase in breathlessness. Is discovered to have problems of anemia, which in turn is worsening her heart failure. So she has acute medical problems. She initially had to be catheterized because of problems of the heart failure and monitoring her fluid status. That introduced an infection and explained her incontinence. She'd had to have a number of medical interventions which had added to her confusion. All of those things were avoidable and in fact reversible, but we don't have an environment which is what we term senior friendly. We have good medical care, but it's not senior friendly and it's not preventing that decline. What the restorative care program will hopefully do is, in the future, when a lady like her is admitted, on admission she'll be identified as high risk for problems like acute confusion. So the staff will be looking at things like hearing, vision, communication. She'll be in an environment where actually she's encouraged to be active as possible. So day after admission she'll be up. There'll be volunteers, there'll be therapists supervising an exercise program to prevent decline. Perhaps the geriatricians will also be involved while she's in acute care in advising about some of the medications and treatments. She may not need to come to St. Mary's. Could possibly go home directly. She may actually be more suitable for a community treatment program through a day hospital or through programs such as CCAC in terms of them following up in terms of physio and OT. And potentially she might need some additional supports for the first few weeks on discharge, but she certainly wouldn't be considered a candidate for long-term care. I think at the present moment, I think families and caregivers can be advocates for their seniors. The healthcare providers don't necessarily know of the services and options available. We see hospitals starting to put in place new programs, but they're doing it in isolation. So we see good practice and lots of learnings within an organization, but it's not being shared between organizations. And there's real opportunities to leverage some of the experiences from one facility with another, and also to link the primary care physician and community into the strategy that the hospital is following in terms of trying to get this individual back into the community. As a geriatrician, and as someone who has a lot of contact with the elderly but also their families, I really believe the restorative care initiative within Clinical Services Roadmap will impact on the care of many individuals, not just the seniors but their families and their friends and their relatives and many people who work with them. I think it would be really helpful if people validate that they think this is an important component of a clinical service roadmap. It would be really helpful, I think, for people to share some of their stories, because it's from the stories we learn about some of the gaps and the needs and the opportunities. And I don't think all those stories are going to be bad, because in fact I know there's many good initiatives being put in place already in anticipation of this type of initiative. What we're trying to do, as I said, is to bring it together and offer it so that across southeastern Ontario there's equitable access to services. There'll be different arrangements of services. There may be different abilities to access a social worker or a speech therapist or some of the disciplines, but there'll be an ability to get a response that's going to help in care. And it'll be really important for the public, for families, for caregivers, for seniors, to remain informed, to be engaged, and as I say, I think to share their experiences and to validate the value of this initiative.